Last week, a 67-year-old man walked into my clinic. Strong guy, worked construction his whole life, built his own house with his bare hands, but he looked defeated. He wouldn't make eye contact with me. Finally, he said, "Doc, I can't sleep anymore. I get up 6, 7 times every night. My wife thinks I'm going crazy, and during the day, I'm constantly looking for a bathroom. It's embarrassing. I feel like I'm losing control of my own body." He paused, then asked the question I hear every single day. Is this just getting old? Do I just have to live with this? If you're watching this right now, chances are you're asking yourself the same question, and I'm here to tell you something important. No, you don't have to live with this. My name is Dr. Sanjay Gupta, and today we're going to talk about something that affects nearly every man over 60, but that most men suffer with in silence. We're going to talk about your prostate. Let me start with something you need to understand. About 30% of men over the age of 65 are affected by lower urinary tract symptoms, Google. But here's what really concerns me as a physician. By age 85, about 90% will have signs of benign prostatic hyperplasia, boom cycle, or BPH, an enlarged prostate. 90%. Think about that for a moment. Now you might be thinking, okay doc, so my prostate gets bigger, so what? Here's what. Your prostate is a walnut-sized gland that sits right below your bladder, wrapped around the tube that carries urine out of your body, your urethra. It's been there your whole life, doing its job quietly. But somewhere around your 50s, sometimes earlier, it starts to grow and grow and grow. And as it grows, it starts to squeeze that urethra. Imagine trying to breathe through a straw that's slowly getting narrower and narrower. That's what's happening to your urinary tract. But here's what nobody tells you. This isn't just about inconvenience. This isn't just about finding a bathroom. Let me tell you about Robert. Robert was 72. For 3 years, he dealt with getting up 5 times a night. He stopped going to his grandson's baseball games because he was afraid he wouldn't make it to a bathroom in time. He stopped traveling with his wife. He became smaller, less confident. The strong, vibrant man his family knew began to fade. When he finally came to see me, he said something I'll never forget. "Doc, I feel like my own body has betrayed me." Do you know that feeling? That sense that your body isn't yours anymore? Maybe you've noticed it too. Maybe it started a few years ago, just once or twice a night. No big deal, you thought, I'm getting older. But now it's more. Now it's 4 times, 5 times, 6 times a night. Your sleep is broken. You're exhausted during the day. Your partner is exhausted too, though they don't say it. And during the day, you're constantly aware of where the bathrooms are. At the grocery store, at church, at your friend's house. You plan your entire life around access to a toilet. And then there's something else, something you probably haven't told anyone. The stream isn't what it used to be, is it? It's weak. It takes forever to start. Sometimes it stops and starts. And when you're finally done, you feel like you're not really done, like there's still something there. Maybe you've even had that terrifying moment, standing there, trying to go, and nothing happens. Complete blockage. That rush of panic. I see it in my patients' eyes every day, that mixture of embarrassment, frustration, and fear. But here's what you need to know. You are not alone, and this is not just getting old. This is a medical condition with a medical name. It's called benign prostatic hyperplasia, and most importantly, it can be treated. Now, let me explain what's actually happening inside your body, because understanding this is the first step to taking back control. Your prostate has been growing since you were 25 years old. That's right, 25. The prostate goes through 2 major growth phases in a man's life. The first is during puberty, the second starts around 25 and continues, well, for the rest of your life. But why? Why does it keep growing? The answer lies in your hormones, specifically testosterone and something called DHT, or dihydrotestosterone. With aging, the plasma level of testosterone decreases, as well as the testosterone to estrogen ratio, resulting in increased estrogen activity, Google. At the same time, the activity of the enzyme 5-alpha reductase increases, leading to a decreased testosterone to DHT ratio. DHT may promote prostate cell growth, resulting in hyperplasia, Google. Now, I know that sounds complicated, so let me break it down. Think of DHT as fuel for your prostate cells. When you were younger, your body kept DHT levels in check. But as you age, the enzyme that converts testosterone into DHT becomes more active. More DHT means more fuel for prostate growth. At the same time, as your testosterone decreases, your estrogen levels, yes, men have estrogen too, become relatively higher, and higher estrogen levels can also stimulate prostate tissue growth. It's like your body's hormonal thermostat gets miscalibrated. But hormones aren't the whole story. Your lifestyle matters too, a lot. Let me tell you about Michael. Michael came to see me at 68. His prostate was significantly enlarged, almost twice the normal size. When I asked about his diet, he told me he'd eaten red meat nearly every day of his adult life. He rarely ate vegetables. He'd been overweight for 20 years. Now, I'm not here to lecture anyone about their choices, but the research is clear. Obesity can be a risk factor for both BPH and prostate cancer, Google News Initiative. And here's something that surprised even me. Research shows that men who have BPH have a lower intake of onions and garlic, which suggests that increasing intake of such vegetables may help ease symptoms, PubMed Central. Onions and garlic, simple foods that many of us already have in our kitchens. Your diet, your weight, your activity level, all of these things influence your prostate health. Because here's the thing, your prostate doesn't exist in isolation. It's connected to your entire body, your entire hormonal system, your entire health. And that means you have more control than you think.
Now, let me ask you something, and I want you to be honest with yourself, even if you're watching this alone. Over the past month, how many times have you felt like you couldn't completely empty your bladder? How many times have you had to push or strain to start urinating? How many times have you had to urinate again less than 2 hours after you just went? If you're answering often or almost always to these questions, you're experiencing what we call lower urinary tract symptoms, or LUTs. Here are the specific warning signs you need to watch for. Obstructive symptoms. Difficulty starting urination. You stand there waiting, sometimes for 30 seconds or more. Weak stream. It used to be strong, but now it's barely a trickle. Intermittent flow. It stops and starts on its own. Straining. You have to push to get anything out. Incomplete emptying. You finish, but you know there's more in there. Terminal dribbling. Those last embarrassing drips that won't stop. Irritative symptoms. Frequency, urinating 8 or more times during the day. Urgency, when you need to go now. Nocturia, getting up multiple times at night. This is the one that breaks men down. That last one, nocturia, let me tell you why it's so serious. Sleep is when your body heals, when your brain processes memories, when your heart gets to rest. When you're waking up 4, 5, 6 times every night, you're not just tired, you're damaging your long-term health. 1 in 8 men will be diagnosed with prostate cancer direct in their lifetime. Now, BPH itself isn't cancer, but here's what's important. BPH may cause high prostate-specific antigen, or PSA, a test result that can also indicate prostate cancer boom cycle. This is why you can't ignore these symptoms. This is why saying, "I'm just getting old," is dangerous. Because BPH symptoms overlap with other more serious conditions: prostate cancer, bladder cancer, urinary tract infections, kidney problems. I had a patient, George, 74, who ignored his symptoms for 5 years. 5 years. When he finally came in, we discovered he had developed hydronephrosis. His backed up urine had damaged his kidneys, permanently. He looked at me and said, "Doc, I thought I was just getting old. I didn't know." That's why I'm making this video, so you know.
Let me paint a picture for you, because this is what happens when BPH goes untreated. Your bladder is a muscle, a strong muscle that's designed to contract and empty completely. But when your prostate blocks the flow, your bladder has to work harder, much harder. At first, the bladder muscle compensates. It gets thicker, stronger, trying to push urine past that blockage. But over time, it gets tired. The muscle becomes less effective. The bladder can't empty completely anymore. Now urine starts pooling in your bladder. That stagnant urine becomes a breeding ground for bacteria, urinary tract infections, over and over again. The backed up pressure starts traveling upward to your kidneys, causing hydronephrosis, swelling, and damage to your kidneys. Your kidneys, which filter your blood and keep you alive, start to fail. But there's more. That incomplete emptying, it can lead to complete urinary retention. Your bladder fills up completely and suddenly you can't urinate at all. Nothing comes out. The pain is excruciating. You end up in the emergency room at 2 a.m. with a catheter being inserted. I've seen men cry from the fear and humiliation of that moment. And there's another consequence nobody talks about, the psychological one. Depression, anxiety, social isolation. You stop going out because you're afraid of not finding a bathroom. You stop traveling. You decline dinner invitations. You become irritable from lack of sleep. Your relationship with your partner suffers because you're exhausted and embarrassed. Your quality of life plummets. But here's what I want you to understand. None of this is inevitable. Every single one of these complications can be prevented, but only if you act now. Not next month, not next year, now.
All right, we've talked about the problem. We've talked about why it happens. We've talked about what's at stake. Now, let's talk about solutions. Real, practical, evidence-based solutions that can give you your life back. Natural remedies and lifestyle changes. First, let's start with things you can do today, right now, without a prescription. Saw Palmetto. This is probably the most well-researched natural remedy for BPH. Studies have shown that the berry of the saw palmetto can prevent testosterone from changing into an inflammatory type of testosterone, DHT, and reduce the size of the inner lining of the prostate, PubMed Central. Saw palmetto is widely recognized in Europe and may help improve urinary symptoms without significant side effects. PLU. Take 320 milligrams daily. Pumpkin seeds. Rich in zinc and healthy fats, pumpkin seed is one of the herbal drugs most widely used in the treatment of BPH. Google. Eat a handful daily or take pumpkin seed oil supplements. Tomatoes and lycopene. In a comprehensive review of antioxidants, lycopene came out on top in terms of its benefits for prostate cancer and potential prostate cancer patients. Google News Initiative. Cook your tomatoes. Cooking releases more lycopene. Green tea. Drink 2 to 3 cups daily. The antioxidants support prostate health. Onions and garlic. Remember what I said earlier? Research shows that men who have BPH have a lower intake of onions and garlic, PubMed Central. Add them to your meals. Exercise. This one is critical. Men who walked briskly for 3 hours a week or more had a 57% slower progression rate of prostate cancer than men who walked less, Discover Walks. But there's one specific exercise that's absolutely essential: Kegel exercises. Now, I know what you're thinking. Aren't those for women? No, they're for everyone. And for men with prostate issues, they're game-changing. For men with benign prostatic hyperplasia, pelvic muscle exercises, known as Kegel exercises, can relieve symptoms by strengthening the muscles around your bladder and penis. Men's health. Here's how to do them. First, identify the muscles. Next time you urinate, try to stop midstream. Those muscles you just used, those are your pelvic floor muscles. Tighten and hold your pelvic floor muscles for 5 seconds. Relax. Repeat 10 to 20 times. University of Virginia News. Do this exercise 3 to 4 times each day. University of Virginia News. Kegel exercises are most effective when started at least 6 weeks before prostate cancer treatment, UVA Health, but they help with BPH symptoms too. A 2024 randomized trial found that combining pelvic floor muscle training with alpha blockers for patients with BPH led to significantly fewer trips to the bathroom each day. Whisk. Behavioral changes. Avoid drinking fluids for 1 to 2 hours before bed. Frontiers. Urinate when you first get the urge. Frontiers.
Limit caffeine and alcohol, both irritate the bladder. Practice double voiding. Urinate, wait 30 seconds, try again. When to see a doctor. If lifestyle changes aren't enough, modern medicine has excellent options. Alpha blockers, medications like tamsulosin relax the prostate and bladder neck muscles. 5-alpha reductase inhibitors, medications that actually shrink the prostate. Minimally invasive procedures include prostatic urethral lift and Resume therapy, which uses water vapor to shrink the prostate. Boom cycle. The key is this: start with natural approaches. Give them 8 to 12 weeks. If you're not seeing improvement, talk to your doctor about medical options.
Let me leave you with this. That patient I told you about at the beginning, the construction worker who felt defeated, 6 months after implementing these changes, he came back to see me. He looked different, lighter. He shook my hand firmly and said, "Doc, I got my life back. I'm sleeping. I took my wife on a trip to see our grandkids. I feel like myself again." That's what this is about. Not just managing symptoms, getting your life back. Starting around age 50 and continuing till at least the point where you have 10 years of additional life expectancy, screening is recommended in iDirect. Don't wait. Don't suffer in silence. Your prostate health is your overall health, and you deserve to live your best years with dignity, confidence, and control. If this video helped you, please share it with a friend who might be struggling too, because the more we talk about this openly, the more men we can help. Take care of yourself. You're worth it.